Assalamualaikum dan salam sejahtera. Saya Najib Arif dan ini Agenda AWANI. Kita belajar banyak perkara tentang bagaimana Malaysia sedang menuju pada negara menua dan juga mungkin akan menjadi negara tua lebih awal dari jangkaan kita. Dan yang paling menggusarkan kita apabila pandemik COVID-19 melanda, ia memburukkan lagi keadaan itu dan juga menyukarkan dan juga memberikan cabaran yang lebih besar kepada Malaysia dalam konteks menyediakan kesejahteraan sosial kepada masyarakat kita, khususnya untuk masyarakat yang menuju kepada ke arah yang lebih tua pada masa akan datang. Bagaimana kita melihat bergerak ke hadapan? Apa solusinya dan juga penyelesaiannya? Kerana di ISWC sebagai contoh, kita ingin mempelajari masalah yang sama kita hadapi di peringkat dunia, tetapi penyelesaian di peringkat negara-negara lain yang boleh kita adaptasi dalam acuan negara kita sendiri. Dan kerana itu kita ingin melihat apakah bentuk pelaburan, apakah bentuk inovasi dan juga kemahuan politik dan ekonomi yang perlu kita pertimbangkan dalam soal ini. Dan juga paling penting adalah segenap aspek dalam perkara tersebut kita rungkaikan. Contohnya kalau kita bercakap soal persaraan, kita kerap bercakap soal siapa yang makan gaji, bagaimana untuk menyediakan mereka dalam persaraan. Tetapi bagaimana untuk kita melihat golongan-golongan dalam sektor tidak formal sebagai contoh. Dan juga dalam industri seni, bekas atlet sebagai contoh. Ini semua kita harus lihat seperti mana kita sebutkan disebut oleh KWSP sendiri, ingin melihat bahawa coverage mereka itu terus dipertingkatkan, kalau boleh seluruh rakyat Malaysia dilindungi dengan sistem pencen ataupun sistem persaraan ini. Itu yang kita bincangkan dalam episod pada kali ini. Saya berbesar hati, saya ditemani oleh 3 special guests. Let me introduce. Next to me is Professor Dr. Syarul Bahaya Kamaruzaman, consultant, geriatrician UMMC. And then next to her we have Dato' Shalin Zulkifli, a professional tampin bowler, and also of course we have Dr. Amjad Rabi, visiting expert SWRC. Thank you so much for joining us. I want to start with Dr. Amjad first. Let's talk about the whole situation, because we are heading towards aging nations, right? And the pandemic of COVID-19 further exacerbate the whole situation of Malaysia providing a good social well-being for elderly. What's the situation like for Malaysia currently, and what kind of initiatives that we have implemented and will be implemented that you think can, achieve a successful goal that we wanted to cater for the elderly community?
Thank you very much. And maybe I start with the positive things. You know, when we look at Malaysia, I worked in many countries, so I always looked at Malaysia as a success story. I bring it to other countries to look at how Malaysia was able to bring in saving from everyone, like 23% EPF, to channel it to the development of the nation. And that's why we see now diverse economy, we see lots of big infrastructure projects that Malaysia developed because of, like EPF and other also big players. However, now things have changed. Development, we have a change now that towards the aging population where needs are different. So what worked in the past not necessarily will work in the future. The main issue we have now, if you look at population in the working age, the people who are aged, let's say 15 to 64, we have about 24 million. Out of them, only the ones they contribute to EPF, 8.5 million. So we already lost large number. What happens when they become older? They don't have any coverage. And it's unfortunate, those mostly are mothers, people who we respect, and this is the values of Malaysia, the respect of mother, but it did not translate into the policy where we see them are protected when they are old. So we need now to look at this new challenge. People live longer, especially women, they are not covered. And those who are covered out of the 8.5 million, it doesn't mean that they will live a very good life. It's actually very little amount of money. So out of what we've seen now, it's like poverty in Malaysia, relative poverty is 16%. This is some data. Now, if you look at senior citizens, it's 42%. It's way overrepresented in the group of who are poor. So we really need now to look holistically and try to find solution to this issue. And we put forward today in the conversation from University of Malaysia's Social Wellbeing Research Center, we put forward a couple of proposals how we can do small steps, but hopefully will solve this issue of lack of coverage and adequacy.
Dr. Amjad, finding solutions is never an easy job because it requires a lot of things. First, about salary. In Malaysia, we're talking about progressive salary we wanted to implement. That's one thing. Another thing is about financial literacy as well. And of course, the system and the structural problems or challenges that we have right now, it needs to be changed, and it requires a lot of political will and economic cost as well. But how do you see, are we on the right track in terms of getting to it and doing it? And also, what kind of things best practices in that sense we can learn from other countries, such as the Nordic countries, for instance, that we can implement in Malaysia?
Well, I think Malaysia now, I'm happy, I was here 2016 to 2018 in the United Nations, then I worked also EPF and University of Malaya. I came back. Now I see really they give us a space to talk about those issues. I've been fortunate to be able to even to present to the cabinet retreat. So it shows that there is interest. They wanted, but it's again like as you highlighted, it's a political solution, right? And that requires, there are many other dimensions. So. But I received, or I have the feeling that they are very genuine. Now, I don't want to go all the way to Nordic countries, right? It's a very expensive system, and I don't believe in shocking the system too much. But we need to look at the starting point, where we are, and try gradually. So what I can quickly suggest, in 2 minutes, one is to look at EPF, the contribution. Now we have 24%, worker, employer, and employees combined. The problem there, it's not adequate, and also there's no solidarity. I say for myself, we need to take at least a little bit of that, maybe 4%, and put it in solidarity fund. Now, not to rob the rich. I don't like that argument. Again, it's to give also the rich out of the 4%. We put it in solidarity fund. Now, everyone, rich and poor, you put 4% with maximum 10,000 ringgit contribution. So the maximum 10,000 ringgit salary. The maximum the rich will pay is 400 ringgit a month. We put it in a fund. Now we give everyone 550 ringgit. And well, actually, we can fix it as percentage of minimum wage, 1/3 of minimum wage. Whenever minimum wage increase, we increase it. So we take 4%. We're not adding any burden on anyone. But at the same time, we can give everyone a little amount of money. Now you top it up. Then you work in EPF. The 550 is not enough, but then you encourage to add EPF contribution. So hopefully that system will add little bit. And then we looking at, for instance, Bantuan Warga Imas. We're looking at how we can make the eligibility much easier to include much more people, and that requires funding. But at least we can do those 2 steps. Enhancing Bantuan Warga Imas to make it covering bottom 40 and middle 40. And for those who don't know, Bantuan Warga Imas is JKM's program for giving the senior citizens who live in poverty. We can expand it to include bottom 40 and middle 40. It requires a little bit of resources from the government. At the same time, including what I said about the solidarity in EPF.
Prof, having aged population is a challenge economically, because we wanted to have them, to have some contribution to the economy, one thing, and to ensure that they can live happily after retirement and all that. So we've seen the current situation and trend on the sandwich generation. It's huge in Malaysia. And at the same time, having elderly population with health condition is another challenge on top of that. But what's the current situation, and how do we tackle this to ensure that we have that aged population that are healthy and can live a stable life after retirement?
Well, there are certainly challenges that are there, both health and social challenges to any aging population. Specifically to Malaysia, what we have in our aging population is that we are having premature aging. Because we have an aging population that suffers from multiple chronic conditions, medical conditions like hypertension, diabetes, obesity, and heart disease, arthritis. So these require ongoing medical care, medications, lifestyle, interventions, etc. And coupled with that, we also have mental health issues that come with an aging population, such as anxiety, depression. And we saw a lot of this during the pandemic that came about. And not forgetting, with all these chronic multiple medical conditions, you are more at risk of developing dementia earlier than before you reach an elderly population. So these kind of mental health challenges, they need to we need to be made aware of. Education, we need to have access, we need to have affordability. We also need to have some social strategies, such as to understand that elder abuse may occur at this stage. What are our concerns about ageism? What are our plans for social isolation and loneliness, which is a big thing that has happened. And we found out that a lot of people who older people that died during the pandemic were actually socially isolated, unable to access, unable to have affordable care, unable to sort of reach care in time. So what we need, to answer your question, is something that's very comprehensive, and we have a Pelan Tindakan Warga Emas that has been set out bearing these strategies in mind. It needs to be comprehensive, it needs to be coordinated. It also needs to be multi-sectoral. There is no one ministry that can tackle everything alone. One ministry can certainly lead, like for example, Ministry of Health or Ministry of Women's, Family and Community Development. However, they need to have this intersection and coordination that is so important when dealing with an aging population.
This coordination and the whole of government approach in that sense.
Yes.
Are we on the right track right now?
Well, there's some discussions towards it, and I'm very positive that with more advocacy towards this, especially in conferences like this, that we could actually work towards bringing things on the table and discussing it openly, because aging is not just for older people.
Yeah.
It occurs lifelong, and therefore we need to make preparations from an early age. And strategic prevention, promotional education, awareness, improving access, getting people a lot more knowledgeable about their health at an early age, that lifelong learning journey needs to start if we are actually to look forward to a healthy Malaysia.
Yeah, these topics used to be taboo. For instance, mental health used to be taboo when we talk to be the main topic to the public, right?
Yeah.
And as well as the rumah penjagaan orang tua, it used to be taboo, but now we've seen a lot of services provided for elderly care, premium in that sense.
Yeah.
So do you think that the community has changed in terms of acceptance that this is the real problem, that we need the innovative solutions in the market? Do you think that the community has that awareness?
Well, certainly there has been a lot of development, exciting developments, especially in this past, even pre-pandemic and post-pandemic. Now we see a lot of AI in healthcare. We have innovative strategies. In fact, some of our NGOs, among them Gerontology Association of Malaysia, hosted an innovative aging conference just before the pandemic, which brought in sort of solutions, innovations to aging in Malaysia. There is in KL Convention Centre every year there's an ASEAN Wellness and Healthcare Conference that brings in all sorts of innovative devices and actually health solutions for the Malaysians. But what we need to do is actually coordinate and compile it onto one platform so that anyone who are stakeholders within this can actually access, understand, and also have more inclusive strategies towards getting there. So communities, to answer your question, are a bit more aware of it. I sit on 3 societies: the Malaysian Healthy Aging Society, Malaysian Society for Geriatric Medicine, Gerontology Association Medicine. These 3 main NGOs, Usia Mas among others, many others in Malaysia, are actually great advocates towards sustaining health in old age, healthy aging, longevity and aging. All these various education awareness things are being done, some in isolation, but there are more and more going on in the community. So it's reaching the community, but right now it's reaching those who are actually, who already subscribed to it. What we need to do is actually get to those who haven't got access, who are not aware, those who are socially isolated, those who cannot understand and may not be educated towards it. So we need to work harder towards that.
I want to get the perspective from our former athletes. Actually, help us to understand, because we've seen few cases before, right? Athletes after their prime time, so-called, and then they face a lot of financial difficulties. And then we start having this discussion about athletes, how do the sustainability of athletes having to earn income and all that. But what's the situation like for athletes currently, and in terms of their retirement?
Okay, currently, starting beginning of this year, in January, we actually started a National Athletes Wage Scheme. It's called SKPA, Scheme Contract Pengajian Athlete, whereby we started getting athletes to contribute to EPF, which we did not have before. So we have about 300 athletes that's in the podium program currently, who's contributing monthly to the EPF, so that they have something when they retire. Because not every athlete has a pension. As of right now, only certain athletes that wins medals in the Olympics, gold, silver, and bronze, gets a pension. And the scheme is pretty good because they get a pension right after they come back. It's not when they reach a certain age, 50, but once they come back, they straight away get the pension for the rest of their lives. So, but for the other 90% of the other athletes that do not compete in the Olympics or do not get to win medal in the Olympics, it's quite hard for them. But we have two, besides the National Sports Council where I work at, we also have YAKIP, Yayasan Kebajikan Athletes Kebangsaan, which takes care of those aging athletes. But they also have to be those who've won medals in the SEA Games at least. So we have about, I think, 3,000 members there in YAKIP. So you can see most of the members that's in YAKIP, most of the expenses are used for hospitalization, for medicine and all those things, even though they've been athletes and have been very active throughout their lives. But for current athletes right now, that's why, I mean, like Dr. Amjad said just now, you adapt to the change, and we are trying to make necessary changes. Probably that was not required before, but are required now. That's why we did the contribution for EPF, and then it's not moving as fast as we want, but at least we're doing something, and actually we're a lot better than some of the other countries, because some of my friends from the other countries, like in the States, in Australia and all the other countries, they don't have what we have right now actually. But we always think that we're the worst somehow or other, but actually we're not doing that bad. But we can do a lot better, and I believe as we progress, we will reach up to that level. And like right now, about 300 athletes, I was saying, has EPF contributions, which is under the podium program, which means the podium program is the cream of the crop of all the athletes in Malaysia. So right now, at this moment in time, we are making them make the contribution monthly, but slowly we might expand it later on after this year. So it's kind of like a pilot project to see how it goes, so that at least athletes, when they retire, they have something in their bank account and not be among the cases that you mentioned earlier just now. Yeah.
I want to ask you about the example, because you have your athlete friends from other countries as well. You mentioned about US and Australia. But I want to talk also about the financial literacy. This is a hard topic to be discussed.
Yes.
But among athletes, how do you foresee? We cannot generalize, but then how do you see the whole situation among athletes? Do they have that financial literacy in terms of awareness that this is not going to be forever, right? In terms of income and all that. So I need to invest, I need to secure my future, and after retirement, after my prime time. Do we have that situation? Right?
Well, actually, I actually met AKPK. Actually, they did a survey on athletes. I think about 480 athletes, and they found the results that they found were quite disturbing. But it's kind of true. But it was never mentioned before. They found out that 1 in 2 athletes do not have any health insurance, and 59% of athletes are not financially literate. So that's why I think it kind of like supports our thought before this, stating that athletes.
Was it because of the financial challenge, or did they?
No, I mean, for you as an athlete, you never think that you're going to retire. Once they think that, they think that, oh, it's kind of like a defeat type of mentality, that, oh no, I'm going, if I think that and I take the first step towards financial literacy, that means, oh, you're not going to be in the team, you're not going to be representing the country for long, which is actually wrong. We want them to prepare for their retirement. That's why we do programs, financial literacy programs, but unfortunately, the awareness among the current athletes is not there yet. Only probably 20% of the 500 over athletes, national athletes, actually join those programs. So we are trying to get them to buy into that. You need to prepare for retirement. So we need to. Most of the athletes, how we prepare for competitions like big major competitions, SEA Games, Asian Games, Olympics, how detailed they are. So we need to tell that okay, when you retire, you
agree.
have to
Yeah.
do it the same, apply the same methodology that you do in sports into your retirement. You don't have to do it like at one go, but probably like slowly, probably an hour a day towards preparing you for retirement. Because sometimes athletes, they get overwhelmed. They're like, oh, it's too hard, it's too heavy, they can't do it. So we try and give them more awareness, probably not in a serious note, or probably in somewhere something that's light, and then they can digest slowly as they progress. And I think once we get them being aware and them actually acknowledging the fact that yeah, okay, I know, because most athletes sometimes they just think short term. When it comes to their afterlife, their retirement, they don't think long term. Some do, but most don't. So that's why they don't have a plan. They don't know what they want to be. That's why most athletes, the IOC actually had a survey done from the whole world, all the athletes in the whole world, and they found that the first 2 years after retirement, the athlete goes through depression because they lose that sense of identity. They don't know what they're going to do, because as an athlete, everything in your life is planned and regimented. What time you go for training, what time you eat, when you go for competition, things like that. So once they lose that sense of identity, when they go into retirement, they get lost. They don't know what to do. So that's why we try and help prepare them for that by giving them exposure on things that they can do probably after they retire. Not only just as a coach, but probably something else, contribute back to the sport, to the sporting environment through the experiences that they've had over the years. I mean, we have athletes like from 15, from 30 years of age. And for athletes, the retirement age is not 50, like most everyone else that works. It can be 20, it can be 14, because of the nature of our sport. Some, for example, like gymnastics, probably retire at 22. 22 is considered old in gymnastics. For me, luckily I'm into bowling. So bowling, we have like 40, 50 still bowling. So it depends. So that's why it's important while they're in the program that we give them the necessary tools for them to prepare for retirement. And most of them think that, okay, my sporting life ends after retirement. So we try to tell them and say, no, it's not. It's only the second chapter of your life. Probably might be even more successful. In your second chapter, you don't know, because not all athletes will be in the 10% style of being like Datuk Nicole David, Datuk Azizul. A lot of them are just like in the middle, or some maybe even just in that gap that misses out on getting incentives and things like that. So we try and give them as much information and do as much awareness as possible. But at the end of the day, is they themselves have to take the first step. Yeah.
Thinking from this point, Dr. Amjad, because at the end of the day, sometimes it's the simplest way, peer-to-peer teaching or influence, right? For instance, in the athlete community, because they've seen certain cases, certain friends who have that awareness, and then they started to save more for their retirement and all that, so the others can learn. But how do we empower this kind of methods? I mean, community can help those who are actually lack of awareness and lack of financial literacy to have that literacy.
I think first I wanted to start by really saluting Dato for this effort. It's very important, the community, they look up to you. I know somebody with that level, and that's very important. The role model of of heroes within the community that can understand and appeal to them, right? Because it's every group is you need to have differentiated approach. It's not like let's teach at school financial literacy and make the assumption it will work. It will not work. We know that. We went to school and we know that. However, I'm not underestimating it. It's very important at school to give certain basic, but the differentiated approach is very important. Now, today I was actually in the conference. Really, I was taken by Ustaz Don. I mean, like a religious leader coming forward with positive message. That's very important, the role of religious leaders to come and speak. And, and in our tradition, I'm Muslim myself, in our tradition, one hadith that always, since I work in retirement and those issues, that Sayyidina Muhammad sallallahu alaihi wasallam was saying, oh Allah, make my, Allahumma ja'al rizqi akhiran, oh Allah, make my best rizq or income when I'm older. So it's just like it tells you, because that's a vulnerable age. We know that story of Sayyidina Umar, that he gave actually social pension to everyone, Muslim, non-Muslim in the community. So it's again, we need to look at, differentiated approach, bring in this religious leaders, education system, and then heroes within each community to deliver messages like this. Now, I wanted to, also to be realistic. I worked in this area for a very long time, and there is limitation. People for hundreds of years or millions of years actually lived until 1950. Life expectancy was about 50 years old, 55 in Malaysia. For millions of years, so that psychologically make us underestimate how long we will live. So any person when they reach 40, they start thinking of, it's end of. So psychologically, we underestimate the longevity risk or how long we live. That's established in many studies. And that's why we need a government intervention in addition to the education. It will always fall short. Not every household, they have educated parents. Not every household, they are best environment to teach their children. Not every school teacher is the best. So we still need to have government intervention to bring it also with the community and education and everyone else. We really need to have multiple or differentiated instruments, like from different actors towards solving this. It can happen over a long time. We can reach a better situation.
Prof, providing a good healthcare system is not just vitally for the whole community as a whole, to ensure that we have, we are aging in the healthy lifestyle and all that. But do you think that we have a good healthcare system currently? Not just the services, but the cost to it, because this is one of the main concerns for our healthcare system. The cost, especially for the private sector, is way too expensive, for instance, right? But do you think that this would be one of the main challenge moving forward?
It needs to be for certain. Generally, we do have a good healthcare system.
Yes.
But there are still certain challenges that we need to overcome. And mainly what you said, it's not just about accessibility and recognition that aging is lifelong and it needs to start from healthy practices from a younger age. And so as you promote longevity with quality of life years. And prevention strategies are very, very important here. So that investment in our healthcare is very, very important. But because there's so many sectors looking at this in isolation, it becomes costly. It becomes costly because we are not actually doing this multi-sectoral, integrated, coordinated, comprehensive look at our aging strategies as an aging population. We're one of the most rapidly aging population in Asia. We're the Asian tiger of aging right now, So we need to be able to plan, and we need the different ministries to play a hand in actually coordinating this. So in terms of cost, I think there are policies. There are certain strategies to improve our aging policy which we're looking forward to. We'd like to see that there is a lot more cross-population and cross-sectoral collaboration in making this policy be more holistic and works for all Malaysians at any age. Because aging, I think people misunderstand. They think that it's just for older people. But the policies need to run from a younger to an older. So it's about healthy aging. You start healthily aging from the minute you're born. So, and in terms of cost, I think with the policies, it needs to be implemented and regulated. The regulation, I mean, it upsets me. Yeah, political will certainly needs to be there. And when there's political will, things can happen. So, I think the time is now. When else? The problem with us in terms of cost is that because there's so many different segments to care, that seamlessness that we need from, being admitted to hospital and then having somebody in the community to actually monitor what goes on after you're discharged, to getting the rehabilitation that you need. For example, if you've had a stroke, you come into emergency, you get admitted to, for example, my hospital, UC Malaya Medical Center. You spend a couple of days getting rehab, and then you're home. There is no GP to monitor your health unless there's communication and a connectivity there. There is no rehabilitation that you not that there isn't, but that access and that awareness that you need it, that ability to have it within your community, that community health hub. So I'm really, positive that, with the health white paper, there are efforts to actually trying to provide seamless care. We need to also educate the public that healthcare can be provided in the community, and this is where it is, because a lot of it is not knowing where to go. And a lot of our, especially my older patients, it's like if they are suffering from memory loss, etc., they go through a windy, tortuous journey of every healthcare professional, including some charlatans along the way, before they come to us as memory specialists. And then by that time, it's for us to actually sort of say, okay, I'm sorry, we can't reverse this. A lot of things have happened, but we can actually do A, B, C, and D. But by which time they have spent an enormous amount of money doing alternative therapies, doing investigations in the private sector, which need to be better coordinated and regulated, as well as then coming to a public side when things have gone awry. Public and private healthcare needs to be better coordinated, especially in aged care services. We can do it. We are working to some extent towards it. We are making it a lot more innovative. We've got virtual wards, we've got telemedicine, telehealth that are coming on. So people who can't access care, we can actually try and see them in the home. But for that to happen, we need there to be community stakeholders, private healthcare, to actually try and help coordinate that. And one way in which we can do something about it is so that, if there are these stakeholders and policy makers out there, and politicians, of course, listening in, we do need to actually try and integrate policy, advocate for an integrated policy on aging. Because if it's not integrated, if it's not multi-sectoral, it won't work. We need to actually try and get many people on the table, and for that we can better coordinate our healthy aging from an early age.
Dr. Amjad, multi-sectoral and integrated initiatives and also solutions and policies in that sense. Where are we right now in terms of that? Because just a few years ago, Malaysia is still talking about, do not work in silo between ministries and all that. So we have to work together, whole of government. We want to learn from this country, and all that. But are we on the right track in terms of getting, the whole ministries, because they are at the end of the day they are the policy makers, to understand the whole situation, the current status quo of the problem, and then come up with a solution based on their respective ministries and come together to the table?
It's a hard question, but based on what I know, like the things that I was involved, like for instance, I mentioned I work with ministries on income security for senior citizens. I've seen that spirit. That there is really genuine interest on breaking the silos and work together. And just also like maybe a story from our tradition in Palestine, like somebody came, so three people, first one is digging a hole, the second person get back the soil in the hole, the third person put water on the hole. And he said, I don't understand what you do. And they said, no, because the fourth person is missing. He was supposed to bring the plant to put it. So that logic, we see it sometimes, I have seen. But I must say, like in income security, I've seen this trying to break the silos, and now we are proposing actually to create an inclusive group of technical people to look at the issue from the stakeholders, especially like the provider of social security. And we are at we have a really multi-sectoral team that can step in and contribute to the discussion. So then we provide to the decision maker really a solution that's already inclusive. So hopefully this will work. I need to come back to the health, because I totally agree with the Prof. I mean, healthcare is a classical issue where like failure to coordinate will escalate cost. That's common, because the main reason is healthcare profession is you have scarcity. You don't have unlimited doctors. So if you take doctors from public sector to private sector, then you compete to provide the same service. And what happens, then the prices will go up. Malaysia has a shortage of medical staff. For every 10,000 individuals in Malaysia, we have 22 medical doctors as one example. In comparison, for 34 in OECD countries, even in Palestine, 27 doctors per 10,000. So this is for many reasons. I mean, but this will actually create like shortage that people, private sector, public sector compete. I must say that I'm very encouraged with the discussion I had with Minister of Health. He understands the issue and he's really genuine in finding a solution. As he's working his ideas, actually, I must say I listen and I can see that really good, the ideas. It's again, I think, important to create essential health package. And this doesn't like somebody like me might want it hair restoration. That's not essential health package. We let doctors decide what is essential health package. I'm glad that you laughed. So, because so they decide what is essential health package, and then the government allocate resources against this essential health package. Now you can acquire it from private, public, but government pays. So that model actually is successfully. You remove the competition and you give the decision to doctors to decide what is essential health package. And as more as resources are available in fiscal space of the country, then you increase what you provide in this essential health package. I think this direction, we've seen many countries going that direction. Hopefully Malaysia will evolve in that direction. We don't want this competition private, public, but rather we wanted just like restoring that healthcare as fundamental human rights. I wanted to go back to Malaysia. This is if I would give two very important success story of Malaysia. One would be education in the like how at time of independence you have very limited number of less than 100 persons who had post-secondary education. Where we are now, we have maybe more than 100 universities in Malaysia. So that shift, that's the amazing, in very short period. The other one is underrated success story is the healthcare in Malaysia, publicly provided. It's underfunded, but it's delivering miracles. At time of independence, for every 10 children, one of them will not celebrate the 5th birthday. Now it's very low now. So life expectancy was 55 years old at time of independence. Now we are above 70. So that's a massive success story. It's done at very low cost relative to other countries. But again, challenges change now. So we really need to look at the essential health package and try to restore public funding for health.
Dato', help us to understand, because the life expectancy for Malaysians between 73 to 75 or 76 in that sense. It used to be 50, no 73. And the next generation would be maybe 100, I don't know. But if it, as a normal person and seeing athletes, athlete communities, we have this thought that, athletes, they are in a healthy lifestyle also, right? So you might live even longer than the average age of Malaysians. So I want to go back to the question of how, because the whole situation that the awareness is quite lacking in that sense, right? In terms of preparing for their retirement and all that. But do we have the willingness in terms of political from the ministry? I'm sure there is, but then what's the situation like to create that awareness among athletes, one thing, and then the athletes itself to understand the whole situation, that they're not going to be healthy forever, they're not going to be earn income forever as an athlete. But do you have that connection between the ministries and the relevant agencies and all that?
Well, actually, thank you. That's a good question. Actually, we have we have some issues as well. Intergovernment agencies, like Professor was saying just now. But we are trying to work together right now, and the ministry has just started getting other ministries involved, like we have student athletes, so we have to work together with the education ministry and so on. So the efforts is there, and I think we also have the same problem. The general problem of aging. Malaysians, a lot of Malaysians are aging. We have a lot of aging athletes as well. As you can see, most of our top athletes are aging, like Dato' Azizul, Pandalela, Datuk Pandalela, Datuk Lemani.
Really,
So that's
aging
why,
in the context of
so
athletes
in the
age,
context of athletes, of course, not in the bigger picture, but so because they've been in the sport for 20 years and 30 years, so actually, it's very important for them and for the younger ones to learn from that and to see what they can do better. And it's also important for the senior athletes also to advise, like Dr. Amjad was saying, be the hero in your sport, in your sporting community, to tell the younger kids that, okay, you need to prepare, because athletes, we're supposed to be healthier compared to other people, but we also abuse our body the most because of our sport. So we are healthy when we are competing, but we have probably carry more injuries later on when we retire. We get arthritis probably at an earlier age, ACL and all those things, because we go through a lot of surgeries and rehabs and things like that. So actually, in a certain context, yes, we are healthy, but we also abuse our body the most, and we also have to go through a lot of health issues later on when they retire. That's why Yakib faces a lot of problems when they have to support and help a lot of aging athletes that has contributed to the country.
Dr. Amjad and Professor Ali, can you share with us throughout 2 days of ISWC, we've discussed a lot of things at length and some presentations as well. But what are the key takeaways from ISWC that you think it's good and it's relatively new to Malaysians and retirement problem as a whole in terms of the discussion?
Well, I think maybe I will start with, not to underestimate the individual act, how it's important. And today actually I started with this story, but it's true that every time, like now, I will ask somebody of my friends to take a photo. It's not because I'm self-centered that I wanted to show off, but I send it to my mother. She's a senior citizen. I know that makes her happy. I selectively send what makes my mother happy. So every one of us, really, we have a role. Right, our senior citizens, they've done a lot for the well-being of Malaysia. What it is now, it's because of the hard work of them. So it's very important for us first to recognize and appreciate, the efforts and do this gesture, whatever to us, a senior in the street or anywhere. Now at policy level, it's really the same thing. We need to have this attitude at policy level, is to find ways that it's not be constrained by the notion of we don't have, our debt is increasing, but we really need to look at it as this is essential. It's very important as fixing a highway. That's something problem with it as this. So it's not that we have little money, so we cannot afford to give our. Actually, we can afford. We did our calculation, but it's political will. So we need to have that level of commitment to our senior citizen from that angle. And there are lots of numbers, but again, because it's a complex issue, it requires all of us to come with the best solution. And but the message is we have an issue, that's good. We need to have the right diagnosis and the political will to get it done.
For me, aging is one issue and one condition which has many integral moving parts. For us to healthily age and meet the challenges that come with an aging population, we have many sectors that could work coordinatedly to actually build something that's comprehensive for all Malaysians, to secure that longevity with quality of life. However, I think one of the first steps that we need to do, and this is a nationwide, all of government initiative, would be to actually align all our various policies to our aging nation. Yeah? So we have a national aging blueprint. I'm looking forward to actually being part of it and trying to see how that can be realized. But unless that, all those policies that we have, and we've got good policies, but we've had very reactive policies to aging. We have something and there was, don't forget the aging population. It becomes, by the by. We need for it to actually run the course and the whole lifelong course.
How can it be proactive?
We can be proactive by actually, I think we could subscribe, and we have. We had Taiping, Ipoh, Penang, now Cebu, now network members of the age-friendly city networks.
Yeah.
And those age-friendly communities and initiatives actually have 8 domains which encompass everything. So that model of aging and healthily aging in a community by way of social participation, making sure that there are civic participation and employment, transportation is okay, outdoor spaces and living environments are age-friendly. And age, I mean for all ages, because if you make everything accessible, affordable, and for all ages, from young to old, and it will actually cater for those with disability, those who are vulnerable. Healthcare need to be, and as the Health White Paper has done, is to try and invest more in community services, community health hubs, making each community, whether it's a sporting community or one neighborhood, actually have those that are empowered, educated, aware, but bringing the various moving parts together in one. We have had strategies towards that. We have had our pusat activity warga emas, we've got our pelan tindakan warga emas. All those actually speak to getting more comprehensive look at aging, bringing coordinated care together. So for that to happen, we need to actually start capacity building with this in mind. So capacity building, employment in these areas, making sure that age friendliness becomes our mantra. And as I said, there are 4 states in Malaysia that have looked at individual things, but how do we do this collectively? How do we follow that WHO framework, sustainable development goals, etc., towards Malaysia, and for each and every Malaysian to actually look forward to growing old, not just by longevity, but with quality. Yeah, it's just like it sounds like a no-brainer. There's a lot of work and moving parts attached. So, looking forward to seeing that happen.
Yeah, Dato', moving forward, it's not just for athletes, but Malaysian as a whole. As we heading towards aging societies, what is your hope? The things that the government, it's not just the government, the whole community and the country should do to improve further.
Well, I think for me, the thing that I see is I hope that more seniors get involved. I think in sports or be active, because I think when you are active, it really helps you not only in terms of your health but as overall. But the way you think, the way you approach everything changes if you're active, and I think that will play a very important part in ensuring that we have quality way of life when we age. Yeah.
All right, Prof, Doctor, thank you so much. We used to in AWANI we used to joke years ago about the aging society. Yeah, I told my friends, if you don't get married at the same certain age, we should create actually a elderly care center, but premium, exclusive, because by that time a lot of people have taken out their APF, they have a lot of money, so we should cater for this market. But now it seems that the business is there already, right? So I need to change, and the new idea is to have gym for elderly, specific. This is my business plan. Thank you so much, Prof, Dato', and also Doctor, for joining us at this time. This is a super important topics, and of course this is never-ending discussions and solutions finding and innovation. Technology coming in to help and propel further in terms of solution. Itu bagaimana kita melihat masalah dan premis yang kita bangunkan sejak 2 hari di ISWC saja, bukan saja di ISWC tapi juga masalah sejagat sebenarnya, dan Malaysia khususnya dalam keterbatasan kita lah dalam soal cost, dalam soal infrastruktur, dalam soal policy, dalam soal sambutan dan kesedaran itu, bagaimana ini boleh digabungkan dan diintegrate, dan kerjasama semua pihak harus digembleng dengan lebih giat lagi. Sekian saja agenda AWANI untuk jam ini. Saya Najib Arif. Assalamualaikum warahmatullahi wabarakatuh.